Hey there. A few weeks ago, we put out an update about charity care. That's the commitment by hospitals to lower or just forgive bills for folks who can't pay them. And our story was partly about how much less charity care hospitals give out than their own policies say they should. And a few days later, I got an email from a listener.
I'm Joey Ballard, and I'm an internal medicine resident.
Joey sent me a link. The American Medical Association, or AMA, the country's largest group representing doctors, and for a long time, one of the most powerful lobbying groups in the country, had just passed a resolution supporting legislation that would require hospitals to do more. Joey said he was the original author of that resolution. He had proposed it as a medical student, and he had gotten the idea from listening to this podcast. We talked. Joey says he's listened to every episode since early in med school, and he sees it as a supplement to what that curriculum provides.
I feel like you really have to seek out other sources to understand the system and sort of what I'm actually joining and what I'm facilitating as a physician. I mean, the podcast really did that and sort of helped peel back this other layer and sort of show more what it's like for patients that I don't always get to see from my perspective.
This is, as I am sure you can imagine, music to my ears. And now, Joey is pushing for more changes closer to home at the institution where he's doing his residency, the University of Illinois at Chicago. And I wanted to bring you a little bit of his story to close out the year. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter, and I like a challenge. So the job we've chosen on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you something entertaining, empowering, and useful. This is not the only time Joey has proposed a resolution to the AMA, and it's not his only success.
I've had 4 that have been adopted by the AMA, which is pretty exciting. And then I've had over 10 for Indiana, the Indiana State Medical Association. So yeah, that kept me busy for sure.
In Joey's first year of med school at Indiana University, IU, he joined the Med Student Division of Physicians for a National Health Program. That's a membership organization that's been advocating for single-payer healthcare for almost 40 years. The med student version is Students for a National Health Program, SNAP for short.
I was pretty lucky. IU is actually the largest med school in the country in terms of enrollment. And so we had a pretty strong SNAP chapter, and they had a lot of great events that really piqued my interest early on.
Joey says SNAP encouraged students to get involved with state medical societies to help nudge the AMA towards supporting single-payer healthcare. And Joey jumped in.
And then through that, I was like, it's not just single payer. I can sort of use this for any kind of thing in medicine I want to highlight or bring up.
In his first years of med school, Joey proposed 4 resolutions that got adopted by the Indiana State Medical Association, including one supporting policies to prevent some people from getting kicked off of Medicaid. By early 2023, he was ready to set his sights on the AMA itself.
And that's when I started reaching out to other student contacts and figure out, how does this work? How do I actually do this for the AMA in the first place?
The answer turned out to be posting a suggestion on a dedicated online forum for student AMA members.
I had posted several, and the charity care one was the one that by far and away got the most feedback and people reaching out to me saying that they wanted to work on it and thought it was important.
That was almost 2 years ago. Next came months of online collaboration with other students, Google Docs, group chats, to draft and refine the resolution itself. Here are a few highlights from what they came up with. Requiring nonprofit hospitals to check to see if any given patient qualifies for charity care before sending them a bill. Close certain loopholes in federal law. So currently, the law only requires hospitals to have a charity care policy, but it doesn't even set a minimum standard for how generous that policy has to be. And there's no mechanism to monitor or enforce even that requirement. This resolution says enforcement penalties should even include the loss of tax-exempt status, which is often worth many, many millions of dollars to nonprofit hospitals. They worked for months, and there were a lot of steps still ahead. A big one was a vote by AMA's student section. That was November 2023. And then 7 months later, the AMA itself asked a panel called the Council on Medical Service to consider the proposal and make a report. And the council made a tweak. Instead of saying the AMA should advocate for policies like this, the council's version said the AMA should support them.
Which is an important distinction in that it's not taking active measures to actively seek out these changes or reach out to lawmakers to draft these kind of things.
Support is more like, if someone else is pushing this, they can add us to the list of supporters. And then in November 2024, the AMA's House of Delegates considered the committee's report. And guess what? Not only did they back the resolution, they changed support back to advocate for. I asked the AMA what that meant they'd actually do next, and a spokesman told me he couldn't disclose their legislative strategy. So, fair enough. The meeting was in Florida this year, so Joey, in the middle of residency in Chicago, wasn't able to be there.
These meetings that are days long, throughout the year, different places of the country, especially as residents, I don't have the time to be able to do that.
Joey says residency doesn't leave him as much time as med school did to work on AMA resolutions at all. But seeing the resolution pass, that was big.
That inspired me to be like, okay, what can I do now? I was like, I feel like I need to take a look at what my institution is doing and what we can improve from that perspective.
He's started working on a proposal to get his hospital, the University of Illinois at Chicago, UIC, to screen all patients for charity care before sending a bill, and to swear off practices like suing patients over bills they can't pay and seeking to garnish their wages. He says he's been picking up support as he goes, starting with individual colleagues and other doctors.
And then the big one is our union.
Residents at UIC are unionized. Joey says he brought up his pitch at a recent union meeting. His idea is a letter to the chief medical officer with as many signatures as possible. The union said he could add them to the list. Joey says he hopes to have that letter ready in a few weeks. Then what? He's not sure.
There's things we talked about during the union meeting that because UIC is a public institution, that there's a lot more ways that it's accountable and ways that we can find out things, which I'm sure we'll explore. But optimistic for now.
And he'll keep at it.
I do find extreme meaning in my day-to-day as a physician, but I feel like this advocacy work is just something that's even in some ways deeper and means more to me.
It means so much to me to know that doctors like Joey are making this their work. And it means a lot to me personally that people like Joey are finding the work we do here useful. In his initial note, Joey asked me where he might look for certain pieces of data. I sent him what I had and forwarded his note to a couple people. One was Eli Rushbanks, who leads research and policy at $4. Those are the folks who have taught me the most about charity care. And the other was Luke Messick, the doctor and historian who wrote the book on some of these issues, Your Money or Your Life, Debt Collection and American Medicine. You might have heard Luke on this show when his book came out in 2023. They both wrote back to Joey right away, and Luke also wrote to thank me for introducing him to the folks at $4. I hope we can keep on making connection for people fighting the good fights, because there's a lot of good fights to be had. If you're catching this the day we release it, or the next day, it's the end of 2024, and our year-end fundraiser is still going, and gifts are still being matched. In fact, we've got a new stretch goal. We've got backers who will match up to $30,000 in gifts. The place to go is armandalegshow.com/support. That's armandalegshow.com/support. Thank you. We'll be back in January with more new episodes. Till then, take care of yourself. This episode of An Arm and a Leg was produced by me, Dan Weissman, with help from Emily Pisacreta and edited by Ellen Weiss. Anna Raymunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. Gabrielle Healy is our managing editor for audience. Bea Bosco is our consulting director of operations. Lynn Johnson is our operations manager. And Armin Aleg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's editorial liaison to this show. Thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. And finally, thank you to everybody who supports this show financially. In fact, here are the names of just some of the people who have pitched in just the last couple weeks. You ready? Thanks this time to Emmy the Brooklyn Wonder Dog, Sally Lewis, Jack Doppold, Megan Emmerich, Barbara Walton, Jupiter Johnson, Abigail KB, Dawn Fuller, Ellen Weiss, Jay Gardner, Kathy J. Sharp, Lois Heitner, Sarah Weber, Heather Clark, Jonathan Tran, Aviva Levavi, Shelley Sims, David John, Cynthia Lee, and Sean Gowers. And not everybody wants their names shouted out, but I cannot resist sharing a few of the places they're from. For instance, Honolulu, Hawaii, Fulshear, Texas, Morrison, Colorado, Dunloring, Virginia, Portage, Wisconsin, Omaha, Nebraska, Temecula, California, Rural Hall, North Carolina, Nashville, Tennessee, Laramie, Wyoming, Castro Valley, California, Salt Lake City, Utah, Ann Arbor, Michigan, Henderson, Nevada, and Buffalo, New York. Thank you.